welcome Dr. Tommaso Falcone from the Cleveland Clinic. We're delighted to have you here, and we're talking about your plenary session for tomorrow, about uterus transplantation and the challenges, or what is it about?
I called it the lessons learned, because as in most innovation, there's trial and error. But the reality is that it's highly level experimental surgery, and therefore we have rigorous inclusion criteria. Good news is the challenges of the live donor, which is inadequate venous return, is not an issue for deceased donor because we take it from the internal iliac, the entire internal iliac. With the live donor, the dissection of the internal iliac vein is very complex, far more complex than doing even a radical hysterectomy. And the alternatives, which people are starting to use, including in China where they did it, the procurement robotically, is instead of even isolating the uterine vein, they just go for the uterovarian vein. But the uterovarian vein is smaller in diameter and perhaps not as long. So our research has focused on the animal model, the monkey model, about looking at to see if we can get viable pregnancies from solely using the ovarian vein. So we isolated, we tied off the artery, uterine vein, then we cut the ovarian vein and then re-anastomosed it, and we had pregnancies and deliveries. Research is focusing on alternative venous drainage and simplification of the anti-rejection regimens. All the transplants that have failed in Sweden were infection. The ones at Baylor were thrombosis. So that's, in summary, is the challenges, the lessons learned from uterus